So that was your first treatment. What's your overall impression been?
Really pleasantly surprised. There's a dip that feels, if you get hot, it then just looks even worse. Obviously the normal lines you get when you go over 40 here, and I noticed recently the shadow in here, which could be hormonal, but I don't know really.
Okay. So you noticed lines across your forehead, frown lines.
Yeah, that one's been there for a long time. It's only getting deeper, and yeah, I suppose the usual here.
Yeah. Okay. And you've also noticed some changes across your lip.
Yeah, like a shadow.
Some shadow in the skin. I think for many people it's a very alien concept, the idea of coming into a clinic and people doing any kind of injectable treatments. A lot of people have concerns or reservations about that kind of treatment. Was there anything on your mind in respect to these kinds of treatments?
No.
So you've heard of them
Yes.
before, but it's not something that you've looked into actively in the past?
No.
So as our face ages, we certainly see a lot more wrinkles on the forehead, the fine lines between your eyebrows, the glabella lines. Other things that you might have noticed is some hollowing underneath your eye.
Yeah.
As the fat pad, the subocular fat pad, which is this little fat pad that causes the eyebrows, it tends to droop with age. The other thing that you notice as well here is that you perhaps lost a little bit of volume in your cheek.
Yeah.
The fat on this part of the face often thins out or atrophies, and it also loses its natural elasticity as well, so the collagen loss tends to cause it to sag. In addition, that tends to cause enhancement of these areas either side of your nose here, which we refer to as nasolabial lines. As the cheek drops, you get the formation of these nasolabial lines here. One other thing that you commonly see as we age is thinning of the lips as well. Find that the lips have a natural eversion, and as we get older you lose that natural eversion and the lip thins out as well.
Yeah.
Okay. So other things that we sometimes see is loss of volume around the chin. Okay. We're all like a natural projection of the chin tip, which as we get older that often flattens out as well. Okay.
It's great getting older.
As also as the cheek drops, you often see around the corners of the chin jowling as well, which got perhaps just a very slight little bit of jowling. So in terms of potential options for things that we could do, there's a few different things then that we were thinking of. There's forehead lines, glabella lines that we refer to here. You have got some hollowing underneath your eye, which you can use filler. You have got some cheek volume loss, and you have got some fine nasolabial lines. You probably have got some slight thinning of your lip, and a little bit of flattening of your chin as well. So you could go to town and do quite a few different bits and pieces. But certainly it would be quite reasonable to do some Botox treatments. You have got some fine lines across your forehead, and you have got some frown lines between your eyebrows here. Could you just raise your eyebrows for me? Okay, and can you give me a really good frown? Okay, and relax. So with age and repeated use and repeated muscle contraction, we all get fine lines across our forehead and in the frown area, the glabella area. Botox is very good for what we refer to as dynamic lines, so that's muscles, that's lines that occur as the muscles contract. What it's less good at is treating resting lines. Now you do have some resting lines there, and Botox may very well soften those, but it may not get rid of them as quickly as you would like them to. So what I typically see with resting lines is that they can be quite resistant to going away completely, and you would typically need to have a few treatments consecutively for them to start to smooth out. So much like if somebody breaks their arm and they've got their arm in a plastic cast, if you take it off 6 months later, that muscle has become thinner. It's a similar sort of scenario here. So that's certainly something that we could look at. Sometimes combining treatments with dermal filler works. If you've got very deep frown lines, which you don't have in this particular instance, then sometimes adding a little bit of dermal filler along with the glabella line often works quite nicely. So that's certainly something that we could try today. Okay. Have you had any Botox treatment before?
No, never.
Okay. Have you heard anything about it and what it does or how it works?
I don't know an awful lot, so perhaps you could explain.
Yeah, okay, I can run through it with you. So, Botox is essentially a treatment which relaxes the muscles. And the way it does that is by blocking the signals from the nerves to the muscles. And that works in a temporary fashion. So typically the treatment starts to work within about 1 to 2 weeks for maximal results. And it will last in the region of about 3, maybe 4 months. If you're lucky, a little bit longer. If you're unlucky, perhaps a little bit less. And as the muscle relaxes, the lines on the treatment area start to smooth out. Okay. Now, where you have quite deep lines or deep resting lines, static lines, you'll find that sometimes those lines are a bit more resistant to treatment. And what tends to work is either to have consecutive Botox treatments, and you find with time those muscles become thinner and the lines become smoother, or sometimes to combine treatments to have Botox at the same time as well as a little bit of filler, particularly for quite deep glabella lines or frown lines. That treatment often works quite nicely. So common areas for use for Botox is typically in the forehead, the frown line area, the crow's feet are the main areas that it tends to be used, although it does have other uses such as excessive sweating, or also known as hyperhidrosis of the palms and of the axilla as well, the armpit.
How painful is it, and do you use a lot of needles?
Yeah, it's a good question. So the needles are very, very fine insulin type needles, so they're about as fine as needles come. There are a number of injection sites across the forehead, but it's a very, very fine needle, and I don't get many complaints, to be honest. It's usually a fairly pain-free procedure.
How long does it take?
The actual administering of the treatment itself is in the region of just a few minutes.
Okay.
So it's not very long at all.
Okay.
Yeah.
Is there any sort of side effects or anything I should be worried about or look out for afterwards?
So as with any injectable treatment, there's the potential for bruising, redness around the injection site typically might last for half an hour or so. Infection can happen, but it's not very common, to be honest. Headache, about 1 in 10 people complain of a headache. Not getting the results exactly right is always a possibility. Some heaviness of the eyebrows occasionally. There are some rarer side effects, but unfortunately I haven't experienced any of them. But I'll be happy to give you a leaflet and we can run through those together.
Okay. And do I need any to sort of do anything afterwards?
The only thing really is just to avoid massaging it heavily for a few hours, and you're supposed to stay upright for 4 hours afterwards. But apart from that, it's really not much you need to do. Okay. So we would normally then invite you back for a review in a fortnight, and if we need to make any adjustments, we can do that. If not, we would normally look to see you in about 3 to 4 months' time.
Okay. Is that how often you should sort of have it topped up?
To get the benefit from it, really, particularly if you've got deeper lines, you ought really to be having it every sort of 3 to 4 months. What you might find if you are having it relatively regularly is that the time between treatments actually extends a little bit. And I do have some clients who use it regularly who can sometimes go to 4, 5, even 6 months between treatments, as they get out of the habit of using those muscles. And as a result, the muscle becomes thinner, and as a result, the lines are thinner as well. Okay. All right. So we're just going to give the skin a little clean with some alcohol swabs just to make sure everything is nice and clean. We'll see. Right, are we good? How are you feeling?
Fine.
You alright to go?
Yeah.
So it's the tiny, tiny little needles. You might feel a little crunch as it goes in, but apart from that, it's just a tiny little scratch.
That's
okay?
fine.
Alright. So really good frown for me. Alright, how did that feel?
Fine. Why does it crunch?
It goes through the connective tissue that the muscle
Right.
sits between.
Okay.
When it goes through, it crunches.
Strange
Yeah.
feeling.
My wife hates that.
Yeah, it doesn't hurt, it's
I do
just
it
the sound.
Yeah. It's a funny
very-
sound.
Yeah.
Does it hurt? How does it feel?
No, it doesn't hurt at all. It's a strange sensation when you sort of hear and feel the crunching with the needle, or the needle going in. But no, it doesn't hurt at all.
Okay, I'll raise those eyebrows for me and relax. And last one, and then you're done.
Is that it?
Well, last lot of injections, and then you're done. Raise those eyebrows again and relax. Smashing. Okay, so that's your lot. So talking about it takes a lot longer than actually doing it.
Yeah.
Yeah.
It doesn't hurt. It probably hurts more to give blood.
Yeah. There we go.
So pleasant first experience.
Yeah, and it's surprising actually how I can't believe how fast it was. That was super fast.
Smashing. So in terms of aftercare, just don't touch the area firmly. Or I should rephrase that. Just
Just don't touch it.
don't massage it heavily for the next day or two. Okay, try and stay upright for the next 4 hours. But otherwise, that's about it really.
Okay.
You will probably start to find that it starts to take effect in the next 2 or 3 days. You'll start to notice, but you probably won't see maximal effect until somewhere between about 1 to 2 weeks.
Yeah. Will it start to sort of feel tight or?
You won't feel anything, you'll just notice that you can't move it. It won't, yeah, but apart from that, you won't actually feel anything.
Oh, okay.
Okay. So that was your first treatment. What's your overall impression been?
Really pleasantly surprised. Obviously a little bit apprehensive and nervous because it's something I've never had done. So I didn't know what to expect, what it was going to feel like. But I'll be totally honest. You answered every question that I had and probably gave me more information than I thought I was going to need. So I didn't feel nervous at all. I wasn't concerned about the needles as such, but I suppose there's always a bit of anxiety, but it didn't hurt. It was sort of a strange sensation, but the speed in which it's done, I was shocked. I can't believe you did it that quick,
Yeah,
to be honest. But it doesn't hurt at all now. There's no pain at all.
So as I was saying, the actual doing it takes a lot short. The actual administering the treatment itself actually just takes a few minutes. It's the talking about it and the planning, the consenting bit that takes the time. It's important that that's done properly to
Yeah.
make sure that you're thoroughly consented for it.
Yeah.
Okay.
No, so I'm really pleased, and
Yeah, lovely.
I can also just be honest. You know, when I've considered previous treatments, it was always very important to me that it wasn't just, you know, someone that can do that treatment. So when I discovered obviously that you was a GP, again I then obviously looked into, you know, what kind of GP you are, because a lot of people can say that they're a doctor. Or what, you know, are they a doctor in toes?
Philosophy.
You know, so I think it's quite an important factor, because you've got the medical history, you've got the training, the experience to actually use and administer needles, you know, without using Botox, just a general, you know, health aspect. And you've got the understanding also of a deep understanding if people did have side effects, how to advise from a GP's perspective as well. So I think that's really, really important.
I think it is important. One of the concerning issues to do with, or one of the big concerns that people have when considering treatments is, you know, who is it that's doing the treatment for them? You know, what are their qualifications? And unfortunately, the market isn't as well regulated as it should be, and there are injectors out there who don't necessarily have any medical qualifications. So I think it's key that you do some background research into whoever it is that you're is going to do the treatments for you.
Yeah, definitely. Otherwise, I think it's a concern that anybody can learn to do something, but the fact that you've got the medical training behind you as well is, for me personally, I wouldn't want to then use anybody else.
Yeah, lovely. Well, look, we'll book you in for a fortnight to see you and review things, and if we need to make any adjustments, we can. If not, great. We'll look to see you in about 2 to 3 months.
Yeah. Okay, lovely. Right, thank you very much.